Today we have a 7-year-old boy who was brought in with a pretty concerning combination of symptoms: fever, earache, and a single seizure. This is where my mind immediately goes toward a potentially serious infection, maybe something that's progressed into the brain. Given his symptoms, we're likely dealing with an extension of infection from either the ear or sinuses, leading to complications in the brain. Now, looking at the initial non-contrast CT scan, the first thing that stands out is hypodensity in the left temporal lobe. This suggests either edema or a developing abscess, and given the clinical history of fever and earache, an abscess is at the top of my list of possibilities. But what really solidifies things is the post-contrast CT scan. There's clear poor opacification of the left transverse sinus, and the dura adjacent to it is enhancing, what we call the empty delta sign. This is classic for venous sinus thrombosis. What's happening is that an infection, probably from the sinuses or the ear, has spread into the venous system, causing clot formation, which is obstructing the drainage of blood from the brain. And this is serious because if left untreated, it could lead to further complications, like increased intracranial pressure or even a stroke. Moving to the MRI images now, things are becoming clearer. On the T2 weighted image, the left transverse sinus is hyperintense, confirming the presence of a thrombus there. But that's not all. There's more going on. There's bilateral ethmoid, sphenoid, and frontal sinus disease with obvious inflammatory changes. This tells me the infection didn't just originate from one localized area. It spread from the sinuses and mastoid air cells into the surrounding structures. I can also see left petromastoiditis, which likely points to an infective etiology that's moved into the brain. Then, in the left temporal lobe, there's a rim-enhancing lesion on the post-contrast MRI, with surrounding white matter showing hypointensity. This is a clear sign of a brain abscess. I also see dural inflammation adjacent to the abscess, which is causing meningeal irritation, adding another layer of complexity to this case. So when we review the diffusion-weighted imaging, the diagnosis really locks in. The left temporal lobe lesion is showing restricted diffusion, confirming that it's an abscess. This is important because abscesses restrict diffusion due to the thick pus within them. Tumors or other types of lesions might enhance as well, but they typically don't restrict diffusion in this manner. And that's what separates an abscess from other possibilities like tumors. This restricted diffusion is a hallmark of an abscess. Now, if I were to be asked, what are the key imaging signs of sinus thrombosis? I'd point to the empty delta sign on contrast-enhanced CT and the absence of the normal flow void on MRI. These are both critical indicators of venous sinus thrombosis, and we have them here in this case. The transverse sinus is thrombosed, and we even have posterior superior sagittal sinus involvement. Serious stuff, because this clotting can cause venous congestion, raising intracranial pressure and possibly leading to venous infarction or hemorrhage. Another question that might come up is, how do we differentiate an abscess from other enhancing lesions like tumors? This is where diffusion-weighted imaging plays such a key role. Abscesses restrict diffusion due to the thick pus inside, while tumors generally won't show this pattern. So when you see that diffusion restriction, it's pretty much diagnostic of an abscess in the right clinical context. If left untreated, venous sinus thrombosis can lead to some serious complications, things like increased intracranial pressure, venous infarction, or even a hemorrhagic stroke. These kids can deteriorate quickly if this isn't caught early. Now, as for management, this case requires a multidisciplinary approach. First and foremost, we need to start this child on high-dose intravenous antibiotics immediately. Think broad-spectrum antibiotics like ceftriaxone and vancomycin to cover both gram-positive and gram-negative bacteria, considering the likely source of infection from the ear or sinuses. We'll also be bringing in pediatric neurology and neurosurgery to assess the need for possible drainage of the abscess. If the abscess doesn't respond to antibiotics or is particularly large, surgical drainage will be necessary. The venous sinus thrombosis is another critical issue. If there's no evidence of hemorrhage, we might need to start anticoagulation therapy to prevent further clot propagation. And in some cases, if the thrombosis is extensive, endovascular thrombectomy might even be considered to help open up the venous system. So just to recap, this 7-year-old boy is presenting with left temporal lobe abscess, and venous sinus thrombosis, secondary to sinus and mastoid infection. The infection has spread intracranially, causing serious complications like sinus thrombosis and brain abscess formation. We'll be starting with urgent antibiotics, consulting the neurosurgery team, and monitoring the thrombosis closely with anticoagulation in mind, depending on the clinical course. These kinds of cases really demonstrate the importance of imaging in the management of complex infections and how critical early intervention is. If you're finding this helpful and want to keep up with more cases like these, hit that subscribe button and stay tuned for the next deep dive into radiology.